Alright, so for the next syndrome we should be discussing in orthopedics, this is a Kelley-Seegmiller syndrome. Kelley-Seegmiller syndrome. So for the Kelley-Seegmiller syndrome, you can see how a patient having this issue is presenting. Alright, and it's a type of Lesch syndrome, So these syndromes are characterized by a whole lot of the patients chewing their fingers, biting their mouths. Okay, so so it's just a rare genetic disorder. It affects purine metabolism. Do you understand? So what is happening in these places? An enzyme known as hypoxanthine-guanine, phosphoribosyltransferase. That enzyme is supposed to have put purines back into use, like recycle them. You understand? So if the enzyme is not there, purines are not going back into use again, but rather they are being broken down. Do you understand? So once they are broken down, you have a lot of uric acid being built up in the body, which is not nice for joints. It will lead to joint stiffness and all of that. So symptoms is hyperuricemia, so high uric acid levels in the body. Gout, so they have painful joints, there's inflammation of joints and all. Kidney stones, joint pain and swelling, muscle weakness, developmental issues. You understand? So unlike the Nyhan Syndrome, this one does not involve neurological issues. Do you understand? Like self-injury. Okay, that's the difference. So I brought Nyhan here so that you guys should see that in Nyhan there's self-injury, while in the Kelley-Seegmiller the person is kind of like very calm. He has an issue, but there's no self-injury coming in. You get the difference? So diagnosis is blood and urine test. You want to actually check out for the levels of uric acid. Genetic testing to identify if there's mutation in that hypoxanthine, guanine phosphoribosyltransferase, gene. Okay. Then you want to also check out the enzyme activity. Treatment, there's no cure, but allopurinol, hydration and dietary, pain management for gout attacks, monitoring kidney functions regularly. Okay. That's just what we have for the Kelley-Seegmiller syndrome.